Hi, my name is Claudia and I'm an FSCJ nursing student, and today I'm going to demonstrate IV insertion. Okay, so the first thing I want to do is check my MAR against the physician's order to make sure that everything is the same. So I'm checking to make sure I have the same names, date, procedure, the reason for the procedure, any known allergies the patient has, as well as any pertinent labs. And these things are in sync with the MAR and the physician's order, so that's good. We can proceed to the equipment. So the equipment I need will be my IV start kit, which is my INT extension. I have my normal saline, the syringe for my saline, my cannula needle, 20 gauge catheter, tourniquet, clean gloves, alcohol swabs, tape, and Tegaderm. Okay, so the first thing I want to do is I'm going to chevron a few pieces of the tape to use later to stabilize the Tegaderm. And I'm going to do one more piece. Okay, so the next thing I want to do is go ahead and draw up my 3 milliliters of saline. I'm going to go ahead and clean the top of my vial with an alcohol swab. Actually, I'm going to wash my hands first. Then I'm going to clean the top of the vial with the alcohol swab. Okay, I'm going to attach, after I remove the cap off my syringe, attach the cannula needle to the syringe. I'm going to draw up just a little bit more than 3 milliliters, just so it gives me some room to clear for any air bubbles. Okay, and I'm going to insert into the vial, insert the air. I'm going to draw up, draw down. Okay. And I just want to get rid of any bubbles. Alright, and I'm going to make this an even 3 milliliters here. Right there. I'm going to remove this needle and place it in the sharps container. I'm going to recap the syringe. Okay, so I believe we are now ready to go into the patient's room. Hi, my name is Claudia. I'm your student nurse today, and I'm going to be doing an IV insertion. What is your first and last name? Tom Jones? Okay. And your birth date, Mr. Jones? October 1st, 1960. Okay, very good, very good. Have you ever had an IV before? No? Okay, well what it is it's a catheter that I'm going to put in your arm so that should the doctor think it's necessary to give you fluids or medication, he can have that administered through this IV in your arm, okay? Alrighty. So, do you have any known allergies? No? Okay. And what is your dominant arm, Mr. Jones? Right? Okay, well I'm going to go ahead and use your left arm then. So, what I want to do is I'm going to wash my hands again, and I want to look for, after he tells me whether he's had any shunts or fistulas or any mastectomies in this arm. No? Okay, very good, very good. All right, so what I'm going to do is I'm going to look for a vein that's soft and bouncy and where there's no bruising and it's just very resilient. I think I see one here. I think this is the vein. Okay, so what I'll do is I'll take the tourniquet and I'm going to apply it 4 to 6 inches above the site. Yep. Okay, all right. Alrighty, so what I'm going to do now is I'm going to go ahead and put on my gloves. You doing okay, Mr. Jones? Alright, in just a minute you're going to feel just a little prick. Okay? You let me know if it's more uncomfortable than a prick. Alright, so let me check your pulse. And that's 2 plus. Okay, so I'm going to go ahead and take another alcohol swab. And I'm going to clean the site where the injection will go. Insertion of the needle. I'm going to do it from an inward, outward motion, circular, from the inside out in a circular motion. I'm going to try to cover the whole area that the tegaderm will cover so that there's all clean skin under there. Alright, that's good. Okay, so while that's drying, I'm going to go ahead and clear the line of my INT. And first I'm going to take an alcohol swab and clean the tip. Okay. I'm going to go ahead and attach this here. Okay, I have to unclamp. And I'm just going to run a little bit of fluid through, make sure that the line is clear. No air bubbles, and I'm going to lock it back. Okay, and so I'm going to go ahead and put that back into this packaging to keep it off the table, keep it clean. Okay, so now I'm going to go ahead, this looks like it's dry. I'm going to go ahead and insert the catheter needle. And what I'm going to do is I'm going to pull the skin taut toward me. Okay? You're going to feel just a little prick, as I said, Mr. Jones, with the bevel side up on a 15-degree angle. I'm going to insert. Okay, I see flashback. I'm going to advance the needle. Okay, advance the catheter and pull the needle out. This will get disposed in the sharps. I'm going to place my finger about an inch above there on the insertion. Above the insertion. I'm attaching my INT. Okay. Alright, so I'm going to unclamp here. Alright, so I'm going to aspirate first. Oh, I've got blood. And so now I'm going to, with a slow push-stop motion, I'm going to flush this line. Okay, we're all done there. I'm going to go ahead and clamp this back. Be gentle here. All right, I've got that clamped off. Now I'm going to take the syringe off. Also, I'm going to release this tourniquet. I could have released that after I had gotten the needle out. Okay, now I'm going to apply my Tegaderm. And I'm going to make sure that I cover the hub. Okay, so I have to pull the paper off here. Alright, so this has a label on it, and once I put the strips of tape on here to secure the Tegaderm, I'm going to place this label to the side with my initials, the size of the catheter, which was a 20 gauge, and the date. So I'm just applying a couple strips across now. I think I'll add a third one. Okay, so now I'm going to peel this label off. Put it to the side. You doing okay, Mr. Jones? Okay, so basically we are done now. I would just make sure these needles go into sharps, discard of all these things where they need to go. Okay, so Mr. Jones, do you have any pain? Well, what I'm going to do is I'm going to make sure the call light is near you, so in case you do feel uncomfortable later or need me for any reason, the call light will be easy for you to access. And do you need to go to the potty? No? Do you need any personal belongings? Anything I can get you? You're good? Okay, how about positioning? Do I need to change your position for you? No? Okay, all right. Well, at this point, I would go ahead and document the procedure. I need to document on his chart the date and the time of the procedure, the size and type of catheter that was used, the number of attempts, the arm that I used, which was the left forearm, and how well the patient documented, how well the patient tolerated the procedure, and if there had been any teaching, I'll document that also. Okay, all right, that's it, and I appreciate your time.